Hello, and welcome to another edition of Preferred Professionals of America. I'm your host, Melissa Castellano, and today I have the pleasure of introducing Dr. Gentian Toshkezi, the esteemed Patient Preferred Physician of the Year in Neurosurgery for the state of Maryland in 2024. With over 24 years of experience, Dr. Toshkezi specializes in treating brain and spinal tumors, performing neurosurgical spine surgery, and addressing neurotrauma cases. As the medical director of the Department of Neurosurgery at Medirus Health in Maryland, he is dedicated to delivering exceptional patient care. So without further ado, let's go ahead and meet Dr. Gentian Toshkezi. Hi, doctor. Thank you so much for being here with us today.
Thank you for the invite, and thank you for your time, and I'm looking forward to a great chat with you.
Well, let's get started. So you have over 2 decades in your field of neurosurgery. What first inspired you to go into medicine, and what is it about neuroscience that appealed to you?
Medicine was my dream since a child. I saw the figure and the image of the doctor as a complete image of someone who saves life and does good things for humanity. Growing up, reading stories and reading books about the medicine, that intrigued me more into the field, and that made me more interested. So in high school, I decided that that was my field where I wanted to spend the rest of my life. This is how I invested myself to start the medical school and further on to do as the residency and specialize in neuroscience, in neurosurgery. I'm a neurosurgeon. So that was fulfilling the dream of infancy and childhood.
Well, truly inspiring. And like you said, you specialize in brain and spinal tumors and traumatic injuries. Tell us about the patients that you see.
I see a variety of patients with brain tumors, trauma, traumatic brain injury, uh, intraparenchymal hemorrhage, bleed in the brain, subdural hematomas, cardiac malformation. I also treat patients with back pain, cervical pain, disc disease, cervical discs, lumbar discs, thoracic discs, a variety of things that neurosurgery field uh, offers to the patients who needs the treatments.
So with all of this, your office is changing the lives of many patients. What medical technologies, if any, do you incorporate in your practice, and how is it truly, changing the lives of your patients?
Neurosurgery is a field that is in progress, and technology has evolved and has been a revolution in the past 10 years. The new technology has allowed us to be heroes in the operating room, to do surgeries that before it was with complications and outcomes that were not the outcomes that we have today. So new technology like neuronavigation, including the robotic surgeries and microscopes of the high end and the new generations that allows us to perform surgeries through small opening with accuracy and great outcomes for our patients, not just saving lives, but also saving quality of lives for those patients and make them live uh, to the normal life after they are treated by us.
And I have to think too that, like you just said, that technology that's really changing their lives, the healing process must be a lot better with these technologies as well, and
Absolutely.
allow them to get back to a somewhat of a normal life after that as well.
Absolutely. When I mentioned the great outcomes includes also a great recovery, shorter time of recovery for the patients, and less pain, and patients who gets back to normal life in a shorter time and with great results.
And what is your most performed procedure that you see often and do often?
Most often, I see patients with degenerative disease of the spine. Is most common in our community where my hospital is covering cervical disc disease, stenosis of the cervical spine, and lumbar spine. We also see traumatic brain injury and tumors of the brain, glioblastomas, meningiomas, metastatic disease, and intracranial hemorrhages.
We seem to be hearing more and more about someone being diagnosed with brain cancer or having a tumor in the brain. How common is brain cancer today?
Um, It's becoming more and more common compared to before. One of the reasons is that now we diagnose the brain cancer more often. We have more diagnostic tools. The patient comes to our attention uh, in, uh, in, in time, and they are referred by primary care doctors. So I think the diagnostic has increased the number of brain cancer. That also allows us to catch those brain tumors in a very early phase of the disease, and that makes it easier to treat and better.
And you kind of answered my next question. It was, why do you think it's becoming more common? And is it because of today's technology? So today's technology and our advancements allows us to diagnose it and see it a lot sooner and than we have before.
Correct. Correct.
So, as an expert in your field, can you tell me what has been your greatest accomplishment to date?
In my professional career, my greatest accomplishment is to be a neurosurgeon. Right now, I'm leading the department of neurosurgery at Meritus Health, and this is one of the achievements uh, that I'm proud of.
Mhm.
It's a department that is starting with a new staff. There is a new medical school. I'm proud to treat my patients, to lead the department, and to train the new generation and the new doctors.
Very inspiring, and what an accomplishment as well. So, congratulations to you for being there. And you were also, congratulations, because you were named the Patient Preferred Neurologist of the Year for 2024. And patients praise you with 5-star ratings and your reviews. And you were featured in Preferred Health Magazine. What does this all mean to you, all these accomplishments?
Um, for me, I'm happy to receive that as a preferred patient, doctor, preferred patient from the magazine, and good rating from the patients. It's evaluation of my work and dedication toward the patient care, toward the field that I'm investing myself. And this is how I know if I'm doing right or wrong and what I need to change in order to become better and to treat my patients better, to take care of them better.
And that's a great lesson for all, right? We never stop learning, right? We're always, we always are inspired and we keep going by, the reviews and everything that we get. So such a great answer there, doctor. And for all those aspiring neurologists, what advice would you give for those who are specializing in brain and spine?
Um, my advice is that to love the field. The neurosurgery field is challenging. It requires a lot of hours of work and training. It requires a lot of years of training. And my advice is to love the field, to dedicate your time and yourself to the field. And the passion keeps you going forward and get the results and achieve the goals that you want.
Wonderful. And is there anything that you would want to add and, let the audience know about you as well?
Uh, I see myself as a neurosurgeon with a passion and dedication to the neurosurgery field. I'm also a father of 2 kids. I have uh, a balance of life with work and family,
Mhm.
and I think that's I wanted everybody to know that it's important in life to have this balance and to feel achieved and accomplished in both fields.
Both wonderful. Well, Doctor, I thank you today, and we're truly honored to have you, and we wish you all the best in the future as well.
Thank you. It was my pleasure.